One of the biggest medical news that really took all the media this week was the fact that FDA put up a very strong warning about all the non-steroidal medications. And I'm talking about Advil, Motrin, ibuprofen, and Aleve. And if you're taking these medications for a long period, I'm not talking about if you have arthritis and once in a while you take this medication once a month or so. That's not what we're talking about. We're talking about people who really take this at a high dose on a long period of time. You are at risk of heart attack and stroke. What's interesting is that the FDA actually made an announcement in 2005, and at that time, as part of the label of all these medications, it basically said that it may cause increased risk of heart disease and stroke. But now recently, this week, they basically came up with the fact that there's a stronger evidence based on more data and more studies out there that it can increase the risk of heart failure. People that are taking these NSAIDs, over-the-counter medications, you have to be very careful, especially if you have a history of heart disease, if you have a heart attack. Don't just take these medications on your own, and this is the biggest news this week. The idea and the cause is still not 100% well known, but perhaps it changes some of the hormones on kidneys. It allows more absorption of salt and more absorption of water, which can cause to high blood pressure. And high blood pressure obviously is a risk factor for heart disease. So big message to the people that are taking these medications for a long period. But Dr. Samadi, you said I need to lose weight, I need to exercise, and as I exercise more, I'm going to have more knee pain and arm pain and leg pain, etc. And I need to take these medications to be able to do that. Well, the way to do this is to really try to change your diet, lose the weight, exercise with a non-weight-bearing exercises like swimming, like biking, like other things that's not going to put too much pressure on your knee. And don't run to the pharmacy and take these over-the-counter medications. As I mentioned, Motrin, Advil, ibuprofen, and Aleve. I would be very careful, and it's a word of caution out there about this. If you want to try Tylenol once in a while, I think it's perfectly fine, but Tylenol has its own problem.